Let me take the video. Okay, there we go. All right.
Hello, hello.
Hello.
Happy last day of 2020.
Oh, yes. Hallelujah.
So, Ludmilar, so just so you know, I told you before, we're talking to you today about how to stay healthy at home.
Okay.
You're going to be viewed by people who love the below the belly button conversations. And so I want to start by having you tell us about yourself. Introduce yourself. Tell me about your educational pedigree and what you're doing with all of that knowledge these days.
So hello, everyone. My name is Dr. Ludmilar Mesidor. I am a board certified adult, child, and adolescent psychiatrist. I went to Temple University for my undergraduate education, followed by my medical school at Touro College of Osteopathic Medicine in Harlem, New York. I did my residency at Westchester Medical Center in New York Medical College in Valhalla, New York. And then I did a fellowship for child and adolescent psychiatry at the Alfred School of Medicine, Brown University Medical School. And currently now I have a private practice and I also do telehealth via Doctors on Demand.
Fantastic. So Ludmilar is also a mother of two. She's also a member of the Mid-Hudson Valley chapter for Jack and Jill. And she has been leading the way and helping us stay healthy at home. So I am calling on you today because I want you to talk about staying healthy, not only from a sort of a physical point of view, but certainly from that core emotional place, certainly given our current environment. So tell me about your passion for physical fitness. When did you come into that? Is this something that you've always loved, or did you happen upon it, one day, in your journey?
Well, I've always been active. As a child, I was a cheerleader. I competitively cheerleadered for many years.
Mm-hmm.
I ran track briefly. I danced in school. And then when I got to college, I still worked out, but not as much. And my real love for fitness came about, like my true love for it came about when I was in residency. Mm-hmm. So after my first year of residency, I realized that all the stress and all the, neglect of myself through medical school and the beginning of my intern year, I had started to not exercise as much. I was eating a lot of high calorie foods. And I had, for the first time in my life, put on weight that I had never had before. And I didn't feel good about myself. I didn't like the way I looked and I didn't like the way I felt. And I said, you know what? I need to get my life together, basically. Mm-hmm. So I started, I actually joined Instagram.
Okay.
And because somebody had told me, and I can't even remember who it is now, but that there were like a lot of fit people on Instagram. So I started following these fitness accounts, personal trainers who would like give free content. And I learned how to squat. I learned properly how to lift. And lifting, to be honest, is my favorite. I do not like cardio, although I do it all the time because it's good for me. But my favorite really is lifting. So I learned how to properly lift, and that became a passion of mine. And then I started drinking water, and I started like looking up proper nutrition and learning about glycemic index, because even though I went through medical school, we don't really spend that much time in medical school on nutrition, unfortunately. So I started to learn about wait a minute, if you're eating white rice, it's going to turn into sugar really fast in your blood and make you gain weight really fast. So it's better to have a brown rice or try quinoa and stuff like that. So that's really where my love of fitness really started to blossom, was in my second year of residency.
So I think your movement toward physical fitness, it really complements your discipline in terms of being a psychiatrist. And that's sort of the space where I wanted to stay with you today. And by the way, thank you. I just came out from the gym. My hair is wet. I have my water bottle ready. I'm chugging it down. I'm doing it.
Good.
But, I was having a conversation with a friend of mine last night, and I said, you know what, all along, my trying to lose weight and stay fit has been for external reasons, to fit in a dress, or because I want to see the number on the scale, or I want to look pretty in the picture. I want you to talk to us about finding a passion for wellness that comes from a place of really trying to take care of your soul, your inner self. And I think that's important because, yes, we're in the middle of this pandemic. There's been a lot of attention to the social injustices that Black and Brown people have suffered over the years. And I find that exercising is sort of a meditative process. It helps to heal the soul. So, but one has to come to it from a place of, God, I really need to take care of me. So that's where I think this is such a unique combination. And we're so honored to have you speak to that today. Like, how do you take care of the mind and the emotion by way of exercise? How do you use the desire for self-care to drive you to drink water and go swimming? Can you, it's like we know what to do, but people can't get started, right? So I want you to speak to that sort of emotional piece for us today.
So, I work out pretty regularly, and it's not just for how I fit in my clothes or what my scale or my pinch tests say.
Mm-hmm.
A lot of it's psychological for me. And I always encourage all of my patients to exercise. And the reason I do that is because we need to take care of ourselves. We have to hold ourselves as a priority, especially as women, and especially as Black women. We tend to sacrifice ourselves a lot for our family and for our friends in our community and leave nothing for ourselves.
Mm-hmm.
And, recently I'm a big Peloton fanatic. Shonda Rhimes has done a Year of Yes series. And something that was said on one of the rides was that I can't be revolutionary if I do not take care of myself.
Right.
And it's very true. Also, there's also another phrase, and I don't know who said it first, but you can't pour from an empty cup.
Mm-hmm.
And, in order to do the things that you need to do for your children, for your family, for your spouse, for your friends, for your work, you really need to nurture and care for yourself first. Your children don't benefit from having a worn out parent. They can sense these things. And even though you may feel like it's selfish to take out that time, you're actually benefiting not only yourself, but you're benefiting everybody around you by having a more positive view. Exercise actually physiologically helps you mentally. So a lot of the medications that we prescribe for depression and anxiety are the same, elicit the same chemical reactions that exercise does. Now, obviously, medication that we give is at a stronger dosage and level than exercise. So you can't, if you have serious depression or anxiety, you still will need medication. However, if you have mild to moderate depression or anxiety symptoms, exercise can definitely help treat that. You release endorphins, you release like norepinephrine, epinephrine, dopamine, serotonin, which are all the chemicals that we try to elicit in those medications. So there's a rush that gives you, that helps relieve your stress and anxiety. Another thing is exercising is almost like practicing for real life. So when you're working out and you're like, trying to do that really hard hill, and it's really hard, and you're pushing yourself, you're saying, I can do it. It also translates to your everyday life. It makes you feel more like you can persevere, and it helps build resiliency. Studies have shown that exercise does build resilient emotional and psychological resilience. And what is resilience? I should define that before I just spout that word out. Resilience is the ability to return to a somewhat normal state after being under a lot of stress. So if you have a traumatic experience or something terrible happens, how you can return back to your baseline way of functioning after that. And resilience is what we all strive for, especially during such a traumatic time that we've been through, whether it's social injustice, dealing with issues with the pandemic, socioeconomic concerns, environmental concerns. So exercise inherently builds resilience, and that is so important. Sometimes when I feel anxious or I feel really upset, I'll do some sit-ups or I'll do a plank, and you actually feel that melt away some of that edge melt off while you do
That
those
does, swimming in the water does that for me. Like, just, I feel like as I'm exhaling, the stress is like going away. I want to bring us back to the pandemic, and I'm going to start by telling you about two conversations. This morning, I found out that my best friend is on her way down to Philadelphia because her nephew killed himself last night. I'm sure there were underlining psychiatric issues there that went unattended, but certainly the stressors that we're all facing now likely contributed to that sentinel event. The other conversation was with another physician colleague who's an infectious disease specialist. Her name is Dr. Simone Wiles. And I was talking to her about the messaging being put out by a lot of the public health leadership with respect to stay home, stay 6 feet apart. And my argument was, in addition to, pounding home the messages around not getting the disease, COVID-19, because you don't know if you're going to end up on the vent or if you're going to be lucky enough to be asymptomatic. We need to pound these kinds of messages, these kinds of conversations as well, right? It is my opinion, and you let me know if you feel the same way. I just don't think that there's enough messaging information around validating the pain that people are going through, right? And so again, I'm really enjoying this conversation because I want us to talk about how to manage that pain. I want us to say to our viewers, we hear you, we feel you, we know it's hard, and this is what you can do to get through the next 3 months. And I know for me, exercise really helps in terms of stress, helping me to sleep better, all of that. So can you chime in on that level a little bit for us?
No, I completely agree. The messaging around mental health hasn't been as a parent. And I think part of that reason, well, this multifactorial, but some things I can just think off the top of my head is that there always, unfortunately, is a stigma that we have in our culture towards mental health in general. Mm-hmm. It's gotten so much better. We still have a long ways to go. Right. And I also think because of the political discord and the non-adherence to the physical measures that needed to be taken into account to help fight this disease, that people never moved on from just harping on those specific points. Right. But I say this all the time to people. We are not meant to be apart. Human beings are not meant to be apart. Mm-hmm. Even people who are extremely introverted still need human contact. We were made to be interconnected to one another, to lean on each other in times of stress, to celebrate with each other in times of joy, to give each other physical and emotional comfort. Mm-hmm. And doing what we're doing right now is actually contrary to normal human behavior. Right. Mm-hmm. But we're all doing this for the good of being able to fight to live another day, as the Friday quote says in that movie. Right. Right. So we're taking a necessary measure to extend our ability to have longevity and to not overwhelm the health system. Mm-hmm. But we also have to recognize that this goes contrary to our nature, which has psychological and emotional repercussions. So how do we take care of ourselves psychologically and emotionally when we're in this situation? Yes, we can exercise. I know I've exercised more. I mean, I used to exercise 3 to 4 times a week. Now I'm working at 5 to 6 times a week. Mm-hmm. So I upped my exercise. Another thing that people can do is, sometimes we get sick of these screens, mm-hmm. And we get sick of doing that. Limiting your screen time can be helpful. I mean, we're all sometimes zoomed out at some points. So also, just because now you can always be reached and you can always see people via Zoom doesn't mean that you should always have accessibility to people, because that also can be draining. Right.
So we need people, but we shouldn't Zoom as much. Is that
what I mean by that is there's fine lines, you know. Some people feel drained by Zoom. So I'll explain. There's preliminary conversations and studies that are happening. They're not conclusive at this point. But they found that there's something they're coining a little bit called Zoom fatigue. When we socialize with people in person, our brains are set up to pick up social cues, movement, smell, scent, all different things like that to be able to socialize effectively with people. When we use digital communications in order to communicate with people, we can't pick up those nuances. Right. So it actually makes our brain work double time in order to socialize via these electronic or digital methods. Yes. And so people can get more exhausted in that. So even though you want to do this to reach out to people also an isolated scenario, and even though you want to use this for work purposes, because a lot of people who weren't working, who were working in person are now working virtually, you do also have to not overdo it, because it can be mentally and emotionally exhausting to be doing that.
Especially if you're working on Zoom all day, like, you know, on the weekends and the evenings, I'm sort of done with the Zoom.
And it makes sense. It makes sense because of, like I said, these are preliminary studies that don't have any, you know, peer review at this point. But when I was reading some of these things that some researchers were saying, I was like, you know, this makes complete sense, because I feel the same way. I do telemedicine, and my private practice now is all virtual, because as a psychiatrist, it's not worth the risk to see people in person at this time. And you know, after a while, sometimes with meetings and different things, I'm just like, man, I need to take a break from doing this. And it's because our brains are working harder than usual in terms of socializing. One thing we can do, and I think people don't talk about this enough, is risk mitigation. So just like you don't want to get pregnant, so you wear a condom, or you use, you know, contraceptives, or just like you still driving a car, but you wear a seat belt. There are risk mitigation things to socializing, and I don't think those are talked about enough.
I've never heard that. So tell me more. What does that mean?
What that means is, you know, you can go outside. Like, okay, right now it's cold, obviously winter time. In many places in the country, it's not cohesive to do this, but you can go outside and meet with your friends outside if you have like sun lamps or heaters outside, and still see people, wear masks, and be around other individuals. You know, not inviting a bunch of people into your home. You still have to have like very limited things, but you can wear masks, open windows, turn on fans. As long as you're masking and there's a very appropriate air circulation and you keep numbers low, the rate of transmission for COVID-19 is significantly lower. So as long as you use, you know, safety precautions with COVID-19, because the things that we're scared about are closeness. We're scared about air circulation. We are scared about those things. So as long as you mask up and have good air circulation, and don't, you know, we're not hugging and kissing, unfortunately, with one another. We're not there yet. You can have some personal interactions with people. And so, I don't think that's talked about enough. I think people, it's like one extreme or it's the other. It's either you don't see anybody and you're stuck in your house,
or you're going crazy and you're getting on a plane.
Exactly. Getting on a plane and you're partying and you invited 100 friends over your house and everybody has masks on and they're dancing and, you know, breathing all over each other. So there's some risk mitigation things, which it doesn't make it 100% safe, of course, but lowers the risk significantly of you doing that. And I'm not saying to do that all the time, but every once in a while, it might be something to do, like maybe once a week or once every 2 weeks, so that you don't feel so isolated from one another. And, you know,
so in terms of how do we get from here to herd immunity, you know, we need to exercise. We need to be creative about how to interact safely, you know, outside of the virtual Zoom world. So this is my push. Like, we need to tell people how to do this. And so again, I'm just loving the fact that you're a physical fitness, soon to be, you know, certified trainer and psychiatrist. I'm loving that combination. I want to swing to, you and I live in the burbs, right? I mean, I do skiing. I did a ski play date with my son and one of his classmates, right? You know, we play tennis. So we have access to outdoor space, outdoor activities. So I want to be mindful of other creative ways to center yourself, to care for yourself physically and emotionally in terms of figuring out how to talk to people and look someone in the eye, if you will, if you live in a building, for example. So, you know, in terms of exercising, what suggestions do you have for that?
Well, first of all, I wanted to say to all the people who live in buildings and stuff, you guys have it harder. You
Yeah.
definitely do. And I want to just put that out there and empathize with you all, because it is much harder in a much enclosed space. However, there are ways to get around that. One of the things that I always tell people is that you have a body that can move, and we have internet, so you can exercise for free. So, you know, if you could just clear an area for 30 minutes, and you don't even need weights, you don't need equipment, you don't need a bike. And if you could just do some jumping jacks, if you could do some sit-ups and push-ups, YouTube. So, you know, there's a lot of negatives of social media, but there's a lot of positives too. YouTube, TikTok, all those apps, if you follow personal trainers or follow people, they will give you free content on how to exercise and tell you how to do things, and that you don't need any equipment for. So I would highly recommend, and you don't need a lot of space for it either, just enough space that you can put your arms out and you can put your legs out. So I would highly recommend that people take advantage of those things. Also too, meditation is very important as well. You know, there's a lot of apps that you can get. There's Calm app, there's just so many. There's ones that are religiously oriented too. One of them's escaping my mind. I'll circle back to it if it comes back. But there's many different apps, and it's really important to meditate too. If you can get a moment to breathe, close your door, breathe with yourself, and follow a meditation to center yourself. If you're a person of faith, you know, many studies have shown that I'm not pushing faith beliefs, but if you have faith beliefs, that can be extremely helpful to you in terms of, especially during tough times. So, you know, praying and taking moments to do that can be really helpful. In terms of what I kind of talk about with like, you know, risk reduction, like wearing the condom, you know, to see other people, it's a little bit harder when you are in a building type situation. You could go to parks, that are open air. I think, in New York City, I'm not even sure right now, because the regulations are changing daily due to the numbers of Cuomo. So, you know, don't quote me on this, but you can have like some outdoor dining with the heaters around, and do things like that to try to, you know, see people in a safer way. And of course, mask up whenever you're doing those kinds of activities.
So I'm going to wrap up, but I just want to summarize the messaging. And the point of my calling on you today is we want to meditate, pray, just have a moment of silence, if you will, for all the people who have died because of COVID-19, those who were ended up in the hospital because they were severely ill. But I do want to pay attention to the caretakers, the people who are left behind, the people who are trying to figure out how to get from here to June. And some are in really desperate situations in terms of job loss. But there are ways to survive, right? And think of exercise not as a means to get rid of your COVID-19. You know, use it as medicine in addition to prayer and meditation, if you can, you know, those are things that are in your toolbox. But I definitely wanted to attend to sort of the mental state of the people who are healthy and the people who are really adhering to the rules in an attempt to stay healthy. That we know that you're suffering, we know that you're in isolation, and we wanted to give you a shout out to you, to say good job, but we also wanted to sort of just delineate a few things that you can do to sort of keep going and feel good and come out of this alive, but also physically and mentally healthy. So I want to thank you for speaking with me today. You've been a bastion of information, and I'm so proud, you know, to call myself your colleague. With that, I'm going to let you have the last word. But I wanted to say happy end of 2020 and happy
Yes,
New
the
Year.
year we all want gone.
Exactly. And
Thank you. Happy New
Year.
Year.
All right. Thank you so much.
So just in,
Go ahead. I want you to have
so
the
just
last
in
word.
closing, just to give a summary, I want you to definitely exercise. Like I said, you don't need equipment, you don't need anything. If you have a you have a YouTube account, an Instagram account, just follow some trainers, make some space in your house. And like as you just said, like exercise is medicine.
Right.
Exercise is definitely medicine. It's not just about losing weight or, you know, getting into a bikini. It has nothing to do with that. It's also medicine. Also make time to pray, make time to meditate, and figure out ways to, on occasion, not often, you can socially distance, meet people where there's good ventilation. You can be separated with each other, and you can, you know, with some distance, physical distance, and you can mask up, and you can do things like, you know, if you have the ability to do a ski date, like she had mentioned, that's a wonderful activity, or do sledding at the local high school where there's snow, you know, with a,
or just running around the block.
Those are great activities to do.
Right.
Yes. Yes. And I also want to encourage you at the end, and I always want to say this, if you do get to the point though, where like you're not functioning properly, meaning that your sleep is become extremely erratic, your emotions are all over the place, you're not caring for yourself, you're feeling very down, having panic attacks, extremely anxious, seek help. There are a lot of psychiatrists who are doing telehealth. There's a lot of different companies that are doing telehealth. There's a lot of therapists who are doing telehealth. And something I learned about recently, especially for the Black female population, is there's an organization called the Loveland organization.
What is it called? Loveland?
Loveland, Loveland. And if you look them up, they actually, depending on your financial means, you can apply and they can sponsor you to get free psychotherapy.
Oh, fantastic.
Yeah, so depending on your means, so you can apply. So that's something to look into if you're really struggling, especially for Black females, because that's the organization's focus, to help you get free psychotherapy if you're in need. So I wish you and all the viewers a happy and healthy new year.
Okay, Dr. Ludmilar Mesidor. It took me a year to pronounce your name properly.
Mesidor, but it's okay.
I'm still working on it. Thank you. Happy New Year.
Happy New Year. Bye.
Okay, bye-bye.